lack of organ and tissue donors is a major problem in Australia. The Institute of Forensic Medicine in Victoria is ground zero in the search for potential donors, and Justine, the nurse coordinator, has the difficult job of dealing with recently bereaved families. This is no easy task, but with a suitably gentle personality and an empathetic approach, Justine succeeds in her role.
The Donor Tissue Bank of Victoria was established in 1989, and it's the only multi-tissue facility in the whole of Australia. So what we do is basically we approach families on a daily basis, families who've lost relatives, for the donation of tissue for transplantation and for research. We normally start about 7:30. We'll come in, we'll assess all of the bodies that have come in overnight, so we'll do a proper assessment of the body to see for their suitability for tissue for transplantation. We'll then gather information like police reports. We may speak to the coroner about seeing next of kin status. We may speak to the GP, we may speak to the hospital, we may speak to a psychiatrist if the person has had extensive mental illness. So before we even think about phoning the family, we've done a lot of information gathering. Then we'll speak to a coroner and a pathologist to get their permission to approach a family, and then we'll make a telephone approach, phone the family at home, and really start the whole process off. Well, my apologies for calling at such an awful time, and the reason for my call is to give you some information about what happens next, okay? Just to sort of have a chat with you and see how you are. So, were you aware that your husband is here with us at the Coronial Services Centre, Mrs. Grayson? So we will assess bodies that come in here, and then we will make phone calls to the next of kin to see if they want to donate things like the tissues we deal with is corneas, heart valves and pericardium, skin and musculoskeletal tissues. And look, it is a difficult subject, and if it's too much for you, we don't have to go any further, okay? But had you or your husband or the family ever discussed the possibility of the donation of tissue for transplantation purposes? We phone in a very respectful manner. We offer condolences when we phone, and we explain who we are and what we do, and really we explain the coronial process, how they navigate through the system, and what happens when a loved one dies. Most people don't know what happens or what to do when somebody passes away. So we give them that information, and then we give them the opportunity, if they want, to donate tissue for transplantation or research. And essentially to get something positive from their loss. It may be possible for your husband to donate certain tissues, okay? Now, and it may be possible for him to donate his corneas and his heart valves and skin. Now, what are your feelings about that? You would think, wouldn't you, that phoning people, you know, you've lost your husband 6 hours before, you get a phone call from the nurse at the tissue bank saying, you know, we know your loved one has passed away, do you want to donate tissue? And you'd think that you probably would get really bad reactions from people, but the ability of people to look at the larger picture is just phenomenal, actually, after they've lost a family member, and we very rarely get a bad reaction from families. Now, skin's used, it's used for people who have been severely burnt, and it's what we describe as a biological dressing, so it helps with their... Okay, skin's taken from the back of the body, it's taken from the back of the upper arms, the back and the sides of the back, and the back of the upper and lower legs, and it leaves... It is difficult. We have a 3-month training period for our nurses, and this is why we have critical care trained nurses. So they are used to a certain extent in dealing with bereavement and with these situations. Saying that, it is extremely hard to do. We only approach families over the phone, so you have none of the non-verbal cues that you would normally get, you know, body reactions, facial reactions, that sort of thing. So the nurses are very much going on what they hear from the family. Hey Kirsty, just got the corneal form for you to fill out. Okay, thank you. What I like is that we have a lot of autonomy. Transplant coordinators are really highly trained, so I work with a large group of very highly trained individuals who are very confident in what they do. So I get a lot of satisfaction from working with professionals, I think. I think it's quite a varied job. It's a very unusual job as well. It's very interesting. We get to meet lots of different people. You know, we get to speak with pathologists, coroners on a daily basis. We're exposed to lots of teaching advantages that we wouldn't normally see anywhere else. So it's sort of that unusualness, I think, which is what makes it interesting.